Hey Boob Groovers, welcome to One World Wellness. I'm Kimberly Lindsay, and today we're going to talk about breastfeeding and chiropractic care. As an IBCLC, I see moms and babies who show up with breastfeeding difficulties. And sometimes those breastfeeding difficulties actually begin in utero. Since a baby spends on average between 38 to 42 weeks in utero growing, they end up, expanding towards the end and taking up all their room. Sometimes they get into wonky positions, such as transverse, sunny side up, breech. Multiples have even less room in there together. So they can kind of get in a place where maybe their neck is kind of like this. And we call that torticollis, where you have long extension on one side and short muscle extension on this side, and the inability to move their neck in their full range. So misalignments show up in the head and the neck and the jaw like that, cause breastfeeding problems, such as an inability to get a nice deep latch on the breast, transfer effectively. That affects their weight gain, colic, stooling issues, sleeping issues. When I mention chiropractic care and cranial sacral therapy to my clients, often what comes to mind is the bone cracking movements that are done on adults. But pediatric care is very different. So for that, I want to introduce you to Dr. Julie Seymour of the Human Joint here in Denver, Colorado, so that when you go into a session, you know ahead of time what it looks like.
My name's Julie Seymour. I'm a doctor of chiropractic, and the name of my practice is the Human Joint. I see whole families, I see everyone, but I like to specialize in prenatal and pediatric care because it's really an important part of being holistically healthy. Most of the kids that I see in the first 6 weeks of their lives, it's about breastfeeding. It's all about latch and whether baby's comfortable, whether what the baby is doing is making the mom uncomfortable is really important for ongoing breastfeeding, especially people who want to do extended breastfeeding. Many of my smallest patients come via referral from IBCLCs because they are the frontline specialists with the breastfeeding issues, and they have the clinical knowledge to evaluate and know who to refer to. Even the most normal natural vaginal delivery can be pretty hard on a baby's head and neck, and so I address those issues of imbalances and misalignments in the cranial bones and the neck bones. TMJ is often involved, and once you get those all balanced out, then the baby's able to coordinate their work and be more comfortable at the breast. If they're struggling with breastfeeding because of some structural imbalance or some misalignment in their cranial bones or their neck bones, then that will go on to manifest itself as other health problems later on. So it's important that we figure out why, if there's a latch problem or a milk transfer problem, that we figure it out early and take care of it so that those subsequent problems don't occur. This baby is now 6 weeks old. She's been under care for 3 weeks because at that time she had had both a tongue tie and a lip tie revision. And I believe they took care of it with a laser. But what happens when you're tongue tied and lip tied, you learn to latch and suck a particular way so that when that revision takes place, there's all this patterning around what you learned to do in the first place. So it was important to get her in here to repattern her muscles and her structure around the proper latch and the proper transfer of milk from breast to baby. There are a few things as dramatic as a baby who's suffering health-wise, and so it's really rewarding work. A lot of times when Western medicine doesn't have an answer for whatever issue is bothering a new parent or a new baby, that chiropractic can sort of fill that gap. It's very much about the gray areas between being well and being sick.